Hello, I'm Angela Powley. I serve as the Regional Executive of Blood Services for the Red Cross in the Greater Carolinas region. I lead a team that works around the clock to help provide a safe blood supply for all patients. Every 2 seconds, someone in the United States needs a blood transfusion. Blood is needed for individuals facing emergencies, having surgery, and fighting diseases. As part of our commitment to ensure blood is readily available, we also work to maintain a diverse blood supply so that the right blood product is available at the right time. Some individuals live with a rare blood disease known as sickle cell. They may require up to 100 units of blood a year to deal with this terrible disease, and they may need these transfusions for their entire life. Sickle cell disease primarily affects people of African descent. Blood donations from donors who are Black have a unique ability to help these patients by providing a more compatible blood type match. But today, donors who are Black make up less than 4% of Red Cross blood donors. This small percentage of donors creates a gap between the significant need to support patients with sickle cell and the matching blood products to meet that need. As we launch our efforts to close the sickle cell gap in the Carolinas, we hope that you will be inspired to schedule a blood donation, help raise awareness about the need of those living with sickle cell, or even host a blood drive. In this video, you will hear from one of our medical directors about the science behind this terrible disease and the need for compatible blood products. You will also hear a personal story of someone living with sickle cell. And we will close with a message from a key community partner. Thank you for helping us take the first steps towards closing the sickle cell gap in the Carolinas.
Hello, I'm Dr. Yvette Marie Miller, Executive Medical Officer of the American Red Cross, overseeing the Donor and Client Support Center. My role at the Donor and Client Support Center is to oversee donor complications, recipient complications, and the notification of donors with their test results. My role with the Closing the Sickle Cell Gap project is as the subject matter expert regarding why it is important for African Americans to donate blood to meet the transfusion needs of patients with sickle cell disease, why we need diversity in the donor pool, and why it's important for everyone to take the opportunity to donate. Thank you so much for this opportunity to share information about why it's important for Black individuals to donate blood to meet the transfusion needs of patients with sickle cell disease. So, any conversation about sickle cell disease starts with talking about sickle cell trait. So, sickle cell disease is the most common inherited blood disease in the United States, with approximately 100,000 Americans with the condition. In terms of specific populations, sickle cell disease affects 1 in every 365 Black or African American births and 1 out of every a little over 16,000 Hispanics or Latinx births. So let's focus our attention to the graphic on the right side of the screen. So this represents a couple, both of whom have sickle cell trait. So every time this couple has a child, they have a 25% risk of having a child with sickle cell disease. There's also a 25% chance that they will have a child that will not have sickle cell trait at all. This child will inherit only normal hemoglobin from their parents. And then 50% of the time, they will have a child that will have sickle cell trait just like them. So people with sickle cell trait are eligible to donate blood. And the Red Cross actually started a program in April of 2021 where every individual who self-identifies as African American will be tested for sickle cell trait. So this is a really important piece of health information that we like for our donors to have. So what exactly is sickle cell disease? So looking at this graphic on the right, this C-shaped cell is the sickle cell, and it's called sickle cell because it was named after a farm implement that was used at the beginning of last century to cut wheat. And on the left side is what a normal red blood cell looks like. It's soft and round and pliable and easily moves through the blood vessels. This odd shaped cell, you can see that it's pointy and it's also sticky. And so the cells clump together and prevent the oxygen from reaching the tissues, which causes the most common complication of sickle cell disease, which is pain. So the second problem with sickle cell disease is that the cells do not have a normal lifespan. A normal red blood cell lives about 120 days, but a sickle shaped cell lives only about 15 days. And so the second hallmark of sickle cell disease is the lack of red blood cells or anemia. So the complications of sickle cell disease are what we try to prevent by transfusion. And so the symptoms of sickle cell disease typically show up in infancy. And that's because when we are born, we have a high amount of what is called fetal or baby hemoglobin, which is very efficient at carrying oxygen. But as we transition to adult hemoglobin, the adult hemoglobin is not as efficient as carrying oxygen as the baby hemoglobin, and so that's when individuals with sickle cell disease first start to show complications or have symptoms. Pain is the most common complication of sickle cell disease and is one of the most common reasons why individuals with this condition present to the emergency room. In general, the disease does worsen over time, which means these individuals, as they get older, will need more frequent transfusions. One of the other really significant issues with sickle cell disease is individuals with this condition have a lower life expectancy. So, in general, in the United States, around 76 years is the normal life expectancy. For those with sickle cell disease, it's only around 54 years. So some of the other common complications of sickle cell disease, one is called dactylitis. That's the medical term for it, but actually it's just the swelling of the hands and the feet. And that again, that's a very common manifestation of the disease in children. And that's because the blood vessels of the toes and the hands are very small. And once those blood vessels are blocked, the fluid cannot return from the hands and the feet, to the central part of the body. And that fluid just accumulates in the hands and the feet. One of the other most dreaded complications of sickle cell disease, which can occur in infancy and in early childhood, is stroke. So, why do we need diversity in the blood supply? First, to meet the transfusion needs of the general population. O is the most common blood type in the population. The donor pool should reflect the recipient population. We need diversity in the donor pool to limit the red blood cell antigen exposure and red blood cell antibody formation, which we'll talk about a little bit more as we progress through the presentation. And for many individuals that require frequent transfusions, like individuals with sickle cell disease, those units of blood have to be very closely matched between the recipient and the donor. And blood donations are needed for equitable access to life saving treatment for patients with sickle cell disease. So again, this slide just gives us an opportunity to take a look at the blood types in the general population. So the Hispanic and Latinx population have the highest percentage of individuals with O blood type at 57%. And then African Americans are the population with the second largest population of individuals with O blood type at 51%. So again, that's why it's important for individuals from that are African American and Latino, the two populations that are most commonly affected by sickle cell disease, to donate blood to ensure that we have adequate amounts of blood available to treat patients with this condition. So let's turn our attention now to red blood cell and Rh antigens. So as you many of you probably know, your blood type is O or A or AB or A. But also there is, that plus or minus sign, and that is related to RH type. So you're O positive or negative. So on the left side of the screen, we're going to look at RH and red blood cell antigens that are more common in the African population or those of African ancestry. So individuals, this antigen that's C negative, that's an RH antigen. So 73% of those individuals of African ancestry are C antigen negative, and only 32% of individuals that are of European ancestry are C negative. This phenotype is a red cell phenotype. It's definitely A negative, B negative, and 67% of those of African ancestry are this red blood cell phenotype. And those of European ancestry, only a very low percentage, in some cases 0%, but there may be, 1 or 2% of individuals that are definitely A negative, B negative. So if we are looking for individuals to match, um, donors to match patients with sickle cell disease, we're more likely going to find a compatible unit from someone that is of African ancestry compared to someone who is of European ancestry. In this country, the majority of blood donors are of European ancestry. Around 75 to maybe even 85% of those of the donor pool are Caucasian, and those that are of African ancestry, only about 1 to 3% of those people who donate blood in this country are of African ancestry. So you see how important it is for those that are Black or African American to donate blood. So we're going to actually look at some patient information here. So this is a patient that we were looking for a unit of blood for. The patient's blood type is O positive, C antigen negative, E antigen negative, K antigen negative, and this is another red blood cell a phenotype called JKB negative. So if we were looking for units of blood in our typical blood donor pool, which is primarily Caucasian or of European descent, we would have to screen 250 units of blood to find a single compatible unit. If we had a significant proportion of those units of blood donated from individuals that are African American or of African ancestry on the shelf, if we screened 250 units of blood, we would find at least 28 compatible units. So just looking at these two slides, you can see how incredibly important it is for those individuals that are Black or African American of African descent to donate blood to ensure that we have adequate amounts of blood on the shelf to meet the transfusion needs of patients with sickle cell disease. So, for those patients with sickle cell disease that have frequent and repeated complications of sickle cell disease, we will put them on what is called a chronic transfusion protocol. And so these individuals need a blood transfusion every single month. And so the amount of blood that an individual needs is dependent on their body size. So a child may only need 3 units of blood, but an adult may need 10 or more units of blood, again, depending on their body size. So a child that needs 3 units of blood per procedure in a year will need up to 36 units of blood. An adult who needs at least 10 units of blood per procedure will need 120 units a year. So you can see, again, with the thousands and thousands of patients that we have in this country with sickle cell disease, how the number of units that we need to meet their transfusion needs rises exponentially. So this is actually a patient with sickle cell disease, and these are his words. His name is Blaze Eppinger, and he was born with sickle cell disease. And as a child, he needed blood transfusions at least once a month. Today, as an adult, he needs to be transfused 9 to 10 times a year. But every time he needs a transfusion, he needs at least 3 units of blood. And these are his compelling words. When I receive the blood donations that I need and my numbers go up, I feel like I'm back to myself. I don't feel the pain. I don't feel drained. It's like putting gas in the car or batteries in your remote. I'm energized. So you can see from his words and his experience how important it is for him to have that life saving blood available when he needs it. So I always have a call to action when I do these kinds of presentations and share this information. So what can you do? You can host blood drives through your employer, community-based organization, faith-based organization, in honor of a loved one, or as part of a charity giving event. You can host what's called a Sleeves Up virtual blood drive. I know that sounds sort of strange, but you can go to redcrossblood.org to our website and set up a blood drive where those that you are interested in hosting the blood drive for, they can go to the website, they can make a pledge to donate a unit of blood, they enter their zip code, and then they can find the closest donation center to them and go there and donate blood instead of hosting a blood drive at a specific site. You can host a blood drive to celebrate important dates. So September is Sickle Cell Awareness Month. Have a blood drive in honor of Kwanzaa. Have a blood drive for African American History Month in February. And June is a very important month for the African American community. Dr. Charles P. Drew was the first medical director of the American Red Cross, and he was African American. And his birth date is June the 3rd. Have a blood drive in honor of World Sickle Cell Day and Juneteenth, both of which, again, are in the month of June. There are some additional benefits of donating blood. I already talked about how we are now testing donors for sickle cell trait, but you also get a mini physical. You get your blood pressure and your pulse and your hemoglobin taken. And I also encourage everyone to download the Red Cross Blood Donor app. So in this app, you can make your appointment, but also you can keep track of your pulse, your blood pressure, and your hemoglobin through the app. And there's lots of other good information in the Blood Donor app. So I encourage everyone to download that app. So in summary, the donor pool should reflect the recipient population, with O being the most common blood type. For patients that require frequent transfusions, like those with sickle cell disease, the blood must be closely matched to prevent complications. African American or Black blood donors are essential and are needed to meet the transfusion needs of patients with sickle cell disease. And blood donations are needed for equitable access to life saving blood for patients with sickle cell disease. Again, thank you so much for the opportunity to share this information. And I do encourage you today to please make an appointment to donate blood. Thank you.
Hello, my name is Naisha Collins. I am 28 years old. I am a single mother of 3, and I currently suffer from sickle cell disease, specifically SC. I was diagnosed at birth. My first crisis that I can remember probably would be at the age of 8. I remember my legs just going completely numb and not knowing what was going on. I got rushed to the hospital, and that's where it required for me to get my first blood transfusion. To some people, to the eye, I look normal, but every so often when I get into a pain crisis, I need blood, and it helps. Like, I don't want to get emotional, but it helps me live for my kids. Like, it's not something little. It's something that helps me live a normal life like everyone else. Without the blood, before I started getting blood exchanges, I probably was in the hospital like, I want to say 10 to 20 plus times a year. When I started doing the blood exchanges, it went down drastically. I probably this year alone have only been hospitalized twice. I get blood, I want to say once every 4 weeks, and I get about the least amount of blood bags I've received is 6. So, and it takes a lot of blood. It takes a lot of people donating blood for me to get that quantity that I need. And it can fluctuate. Sometimes I need 6 bags, sometimes I need 13 bags, and that's collected from people that donate. The beginning of this year, like when COVID had hit really hard, like I said, I'm scheduled to get blood once a month, every 4 weeks. And I want to say there was a period for 4 months where my blood exchanges just had to completely stop because they were low on blood. It was like a heart-wrenching feeling, because now that I know what's going to come with that. With me not getting any blood, I know that I'm going to be in pain more. I'm probably going to end up in the hospital from a pain crisis. I'm not going to be able to function without that blood, because without me receiving it, a whole lot of health problems come with that. I'm not able to care for my kids. I'm not able to go to work. I'm just not able to live a normal, fulfilled life without the blood products. And when they say that there's a shortage on blood, that pretty much just breaks my heart, because I know what all is going to come after that until they are able to get enough blood in to treat my sickle cell. You know, they say it takes a village to raise a child. Well, it takes a village to maintain our health, even in adulthood. So, blood donors, you are a very important part to our well-being, because without you guys, we probably wouldn't be here. My blood has dropped a few times. I've bled from my kidneys, and while I'm bleeding, I'm having to receive blood at the same time from someone who went and took the time out of their day to donate. And so I am grateful for that. You guys are the reason why I'm here today. You guys help me be a great mother to my children. Like, without you guys donating, I wouldn't be here for them. So for that, I am so grateful, and I appreciate you guys so much. And if you can, just please donate. Please just take the time out of your day and just donate. It helps a lot. You might think you're not helping, but I promise you are saving lives. You really are. And I just thank you. I'm grateful. My children are grateful. My family's grateful. It's just a big help, and I thank you so much.
Hello, my name is Shanavia Montgomery, and I bring you greetings from our South Atlantic Regional Director, Dr. Trish Johnson, and Regional Representative Director, Ilana Jameson of Delta Sigma Theta Sorority Incorporated and our Delta Emergency Response Team, sharing an important message with you regarding your ability to help save a life. Every day, the American Red Cross is in local communities providing aid to those facing emergencies. That work includes supporting the health of our communities through blood donation. Delta Sigma Theta is proud to partner alongside Red Cross chapters across the Carolinas to bring an initiative to life that makes a meaningful difference for patients. As we've heard from the testimonials of individuals living with sickle cell disease, as well as Red Cross Executive Medical Director Dr. Yvette Miller, who is also a member of our international sorority, compatible blood products are critical to improving the quality of life for those living with sickle cell. Black donors are more likely to provide that closely matched blood donation for the estimated 100,000 people who have sickle cell disease. The Red Cross needs the support of new and existing Black donors to give blood in support of its Closing the Sickle Cell Gap initiative. We also urge organizations and businesses within the Black community to host blood drives to help provide convenient locations for friends and family to donate. We hope you will join the South Atlantic region of Delta Sigma Theta and other community partners of the Red Cross and commit year-round to helping maintain a diverse blood supply to ensure the right product is available at the right time for a patient in crisis.